Welcome, everybody, and we glad to see you on today's CE, continuing education from our friends in the pet owner and shelter world. So today's topic is stay at home does not mean stay on the couch. Get moving with your pet. And our speaker is Kara Burns. Kara is a licensed veterinary technician with a master's degree in physiology and a master's degree in counseling psychology. She's the founder and past president of the Academy of Veterinary Nutrition Technicians and has attained her VTS in nutrition. She teaches nutrition courses around the world on the VIN Veterinary Support Personnel Network and on VetMed Team. Kara is the director of nursing for Brief Media, as well as the editor of the Veterinary Team Brief. She was named North America's Veterinary Conference Technician Speaker of the Year in 2013 and in 2016. And she has graduated honorary VTS in internal medicine in 2011. And she was also granted an honorary VTS in dentistry in 2012. We welcome Kara.
Thank you so much. This is wonderful. Hi, everybody. Thank you for being here. We are going to talk a little bit about really keeping us all moving while we are quarantined at home. Typically, I do this from a nutritional standpoint, but I also do it from a, we need to keep moving. And we're going to go through a lot of that, but I just wanted to say hi to everyone and thank you so much for having me, and thanks for being here. Hopefully we're going to have a little bit of fun. Hopefully we'll learn a little bit, and at the end we will be doing some questions. So yay, let's get started. Okay, first, a huge shout out to Assisi Animal Health. Thank you, one, for having me, but thank you also for providing these webbies to pet owners. This is an awesome opportunity for all of us to just kind of sit back and talk about, some of the things that are happening in our pets' world and in our pets' lives. So thank you. So, coronavirus disease, who is, I don't know, tired of hearing it, maybe fearful of hearing it? We've been dealing with this now for at least a couple of months, if not a little longer. And throughout our nation, we have been told to stay at home and shelter in place. And that has been unprecedented, right? We are just, staying home. We're not going to work. I mean, some people are, and as of probably yesterday, some of the states are lifting their, or easing their restrictions. I wouldn't say lifting, but easing. And so we are faced with new and unprecedented times. So we've also been told to flatten the curve, right? Flatten the curve. Well, we're going to do that by staying home. Absolutely. We are following, what the CDC is telling us. But how do we flatten the curve while not getting curvier ourselves, or not having our owners, or our pets get curvier? So, the bottom right hand, we're all saying, oh yeah, I'm in a really good place right now, not emotionally or spiritually, because we're all very tense. But we're in a really good place because we're on the couch with our dog, right? So we are spending more time at home. Thus, for those of us who are pet loving individuals, we are spending more time with our pets. And what I'm going to encourage us to do, obviously by the title of this presentation, is we need to maybe, exercise a little bit more. Now, I'm aiming this at our pets because I certainly could use a lot more exercise. So I am not going to insinuate in any way that the humans listening need to exercise. But I will tell you that physical exercise has a lot of benefits for both humans and and our pets. So we're going to look at how physical exercise, or maybe the result of not exercising, can increase stress, and how physical exercise is going to help alleviate that stress. Physical exercise also helps with inflammation, and with osteoarthritis, we see a great deal of inflammation. So physical exercise is going to help, almost consider it to be an anti-inflammatory. And then physical exercise obviously is going to combat obesity. And we'll talk a little bit about each of these, and then tie it up with some stress relieving activities, both physical and emotional for our pets. And then we'll look at some questions. So get moving. We need to get moving, right? You'll see a lot of the brachycephalic, smush face breeds, which you see 2 French bulldogs in the lower corner, because those are my particular favorite. But as all of us, we probably love all dogs. So we need to get moving. It's the most effective non-medication or non-drug treatment. Physical exercise helps to reduce pain and helps to improve movement in our osteoarthritic patients. Obviously, exercise is going to help our pets lose weight because we're seeing calories expended, and just that movement is going to improve our overall health. And when I say I am focusing on our pets, but there are studies showing that pets and people exercising together, both the humans and the pets benefit. And exercise, if we could just get up and do it, is a great stress reducer. Exercise helps to release tension. So let's start first with osteoarthritis. What is osteoarthritis? Well, many of you probably have heard about it. Many of you may even have it. Osteoarthritis, if we wanted to look at a formal definition, is progressive joint inflammation, which then leads to deterioration of cartilage, and basically the breakdown of the joint. And like I said, many of us probably have osteoarthritis, or you know someone that has osteoarthritis, and it's pretty painful. If we look at the cat and dog world, about 20% of dogs, doesn't matter if they're small breed, large breed, 20% of dogs have osteoarthritis. 33% of adult cats and 90% of cats 12 and over have also have osteoarthritis. So we're seeing a great deal of osteoarthritis in our cats and dogs. And it's actually the #1 cause of chronic pain for our pets. So we really need to try to focus on alleviating this pain and getting, again, the theme of this this presentation is to get moving. So where does osteoarthritis occur in pets? It's actually very similar to us as humans. It's in our pets' shoulders, similar to our shoulders, elbows, their wrists, sorry, which we call carpus, okay, knees, hips, their backs, okay. I've had a number of back surgeries. I know that I have osteoarthritis in my back. So it's no different for our dogs and our cats. And then on the right-hand side, you see pretty much the same thing in our cats. Again, the shoulder, the elbow, also in the carpus, their hips, their knees. So we can sympathize with our pets. If any of you have osteoarthritis, you can sympathize with your pets. And for those of you who have heard about it and heard how painful and mobility limiting it is, then you also can see and just kind of, yeah, feel for your pets that have osteoarthritis. This is just to show you a joint. This is a knee joint, and on the left-hand side, you see a normal joint. So you see the synovial fluid. I'm not sure if you can see my pointer or not, but on the right-hand side, you see a knee joint with osteoarthritis. So we are going to have narrow joint space. Osteophytes, which are little bone fragments, if you will. The knee capsule, the knee joint, if you will, is thickened. And the cruciate ligament, so the ligaments within our knees and within our pets' knees, start to degrade. And to see it a little more officially or anatomically correct, here we have a knee joint. Again, on the left-hand side is a healthy knee, and on the right-hand side is arthritis. And you can see the arrows are pointing to that the ligament, the meniscus in the knee, the joint itself. This one here, if you can see my pointer, that would be an osteophyte. And you can see just the wasting on this knee. And so imagine if we can look at it in this form, imagine how painful that must be for our pets. So I would typically ask you guys, what types of signs do you think that you would see in your dogs? And most often we're going to hear rising from rest. They're having a lot of difficulty actually getting up from a resting position. Maybe they don't want to walk. They're avoiding climbing the stairs where they used to just bound up the stairs. They don't want to, run. They're not jumping because they're in pain. What are some of the signs in cats? Well, in cats, what happens is cats are very stoic, not that dogs aren't, but cats don't want to give the impression that they're weak in any way. So they hide their signs, they hide their pain. If you were to bring them into a veterinary hospital, it would be very difficult for myself as a veterinary nurse or the veterinarian to look at the cat on the, do a physical exam on the table and tell, is this cat in pain? Is this cat showing signs of osteoarthritis? But actually what we do is we're going to talk to you as the pet owner and ask you questions and ask you really to tell us what has been going on with your cat. And there's basically 4 categories that we're looking at. So mobility is the first. And what oftentimes we're going to hear is that, the cat isn't jumping anymore, is very reluctant, used to jump on the counters and, doesn't really do that anymore. Or will jump on the table, but will jump to the chair first and then to the table because it's less painful. We also may hear of the cat, urinating or defecating outside of the litter box, pretty much right next to the litter box. Now, the veterinary team will have to look and rule out any urinary issues, but oftentimes the box is too high and the cat is too painful to get into the litter box. Activity levels. You may tell us that, yeah, my cat has just kind of been laying around, not his usual self. With grooming, again, you're going to tell us, oh, he doesn't really seem to be grooming himself. And we're going to be able to tell because typically this cat is also a little too portly, but typically osteoarthritis, they won't be able to groom in their back half of their body. So we'll start to see mats, and you may start to see mats happening. Cats, no longer can stretch out and scratch their claws. And so maybe they're growing around a little bit quicker. And then finally, another area that we are going to be talking with you as the owner about is their temperament. Are they hiding more? Cats love to play in paper bags, but maybe they're going into the bag and not playing and not coming out very quickly. Maybe they look, a lot of people would look at the cat on the right and say, oh, he's angry. I would look and say, he's in pain. The way he's holding himself with his ears, we can tell that he's in pain. So if you get a lot of questions regarding, some of the things that we just went through, it's because we're trying to figure out, we being the veterinary team, are trying to figure out what truly is going on, and could it be signs of osteoarthritis in your cat? Now, Assisi Animal Health, again, thank you for putting these on, but they have some tools to help with inflammation and pain. And the pulsed electromagnetic field therapy is a proven therapy. It's a therapy that is used by veterinary hospitals and veterinary rehabilitation experts. And what's happening here, you see this loop, the Assisi loop, which you may have heard of, you may even have one. It delivers a signal that's tuned specifically to minimize pain and accelerate healing. Now, we saw that joint and how painful that joint looked. So if we have an electromagnetic field that can help with that pain, to me, that's just amazing. Because what it's doing is it's stimulating the body's own natural anti-inflammatory process while it's speeding the healing of the soft tissues. So pretty amazing, and a great way to help get our pets moving. So the second thing that I wanted to talk to you about is obesity in our pets. Now, that pug, yeah, he's adorable, but that pug is very overweight and is going to have a number of issues if he doesn't already. Cat in the middle, the English bulldog on the right, all are overweight. And really, obesity isn't just a cosmetic issue. What obesity is a health issue, and it's an epidemic. It's an epidemic in people, in cats and dogs and horses and birds, you name it. And actually, Dr. Ernie Ward, who I think you may have heard speak before, he does a lot of research in this area. And just under 59% of dogs and 60% of cats in the United States are overweight or obese. And we saw the pictures. I can tell you as a veterinary technician, a veterinary nurse, we are seeing a lot of overweight pets. And so what I want to talk to you about is some of the consequences, but then as I promised, we're going to talk about getting moving, okay? I don't want to focus on all the negatives, but we have to go there first so we can appreciate the positives. So if you were to look at this dog, and if I were to ask you, what are some of the things that you're seeing? You may say, well, he's an adorable golden, which he absolutely is, but I don't know if you can see, his legs in the back are splayed. So that means there's a lot of extra pressure on those legs. The front, he's kind of pigeon-toed, if you will. He's pointing them in. So these four legs are trying to equalize the weight of his body. He's panting. So he has a lot of respiratory issues because of the extra weight. And so oftentimes we on the vet team will take different views. And so you see here that there's no figure if you will. And then I'm not a radiology expert, but I think we all can see some of the issues here from this golden in the middle. You know, the hip dysplasia, the bones are breaking down because of the amount of weight. So what are some of the other conditions associated with being overweight or obese? Well, the first one, as we've already talked about, is osteoarthritis. And then I think a number of the other risks that we're all familiar with in our pets: difficulty breathing, diabetes, heart disease. Overweight pets may be at an increased anesthetic risk. They're at increased risk for some cancers. Overall, you know, extra weight on our pets is not helping our pets. Believe me, I am right there with you, and I know how hard it is to not treat or to give treats, I mean by that. And, you know, oh, but they're cute. And I still think that pug is adorable. But from a medical standpoint, I can tell that that pug isn't 100% healthy. And if we want him to live longer, we can get the weight off. This oversimplifies it, but basically what we're looking at is less calories in, more calories out. So what do I mean by that? Just like in the title, we want to get moving. Okay, we want to get our pets moving, and any little movement counts. Okay, I know we can't go to dog parks right now. I know, you know, there's a lot of restrictions, but even just walking around the house is going to be a huge benefit to your pet. So we're also, as we established at the beginning, under stay-at-home orders. But stay-at-home orders also mean stress at home. Because not only has our everyday routine changed, but it's changed significantly for our pets also. Pets are experiencing stress and anxiety right along with us. So we may be worried about the future and worried about, you know, when are we going back to work? When is, you know, when are restrictions going to be eased? Our pets are feeling that. They can feel our feelings. Dogs can recognize different human emotions. And so what we need to do is work through some of this stress. We're working from home, right? I'm not sure how many of you are still working from home, but obviously I am. And, you know, our dogs and cats aren't really understanding what is happening because we're always, you know, at some desk with that thing open with pictures on it. So how do we pick up stress in pets? Well, again, we may see changes in toileting. So maybe they're not, you know, using their litter box, or maybe they're not making it outside. We may see some GI disorders, some GI issues, increased grooming, decreased food intake. So lots and lots that I'm sure you guys are familiar with. Obviously, this image is associated with the last one, and that's destructive chewing. So maybe as a puppy they chewed shoes, but now, you know, with all of us home all the time, they may have started to chew more often. Maybe some of the furniture shoes, they're getting into things that they haven't been. That is a sign of stress. So let's get moving, because getting moving, whether it's a little or maybe a little bit more, is going to help with all three issues: stress, being overweight or obese, and osteoarthritis, pain, and inflammation. And it doesn't matter the pet, we can get them moving. As you see here, you know, taking cats on a walk with their, you know, on a harness, so it's a safe walk. Let's get them some toys. Cats love catnip stuff. And the one in the top left, catnip mouse. He's not giving that up. And then interactive toys in the top right. They love feathers and things to chase. And then, hey, even working out with your pet. Obviously, I didn't have a picture of me working out with my pet, so I had to find one. And that guy looks like he's in pretty good shape. And so does his cat. And I'm going to attribute that to him working and the whole family moving. So what about dogs? Dogs, we can take dogs on walks. We can, play ball with them. Just throw in a ball, how excited do they get? But it doesn't even have to be that involved. Chew toys, as you can see in the middle. Or even when they come over and pretend that they're doing yoga with us or Pilates or whatever it is that you're into, yeah, that's getting them moving. If you get up and walk to the refrigerator, it kind of defeats the purpose, but at least our pets are walking with us. Unless we're getting water or juice or something, not ice cream. Okay, that's what I do. So, but anyway, so here we go. Let's get moving. Now, what else can we do for physical and even emotional exercise? Dogs and cats get bored just like humans do. So there are feeding puzzles, there's interactive puzzles. And so you can see the one in the middle is a feeding puzzle that you can purchase. The one on the right, the bulldog with the bone, and in that bone you put treats, and they have to work to get it out. It's stimulating their mind, stimulating their brain, and making them work. So even just rolling that thing around is going to be some exercise. Now, they don't all have to be purchased. I know now is a very difficult time financially. So if you have a muffin tin and some tennis balls, just put some treats in under a tennis ball or two, and then put tennis balls in some of the others. They have to work for it. If you don't have tennis balls, you can still use a tin and maybe just put some, little small amount of canned food in there. Again, they're having to work for it. Cats are the same way. Physical and emotional exercise. Cats absolutely need to hunt. They need to, go through their hunting instinct. They like to hide and play. So cat condos like you see on the left. Toys like the second from the left. They love to play with those, or at least mine do. And I've seen a number of others. Now, you can also make feeding puzzles for your cats, and that also helps with the hunting instinct and spreads out the amount of food that they're getting throughout the day. So an egg carton with some kibbles in it, they're going to paw at them and try to pick them up. The one that is second from the right, sorry, that looks a little blurry, but that's just a water bottle, a plastic water bottle, but you're reusing it because you're poking some holes in it, putting some kibble in there, and then just letting them run through the house or roll it around to get the kibbles out. So there are so many different ways for us to come up with physical and emotional exercise regimens. Like I said, it doesn't have to be extravagant. And it also doesn't have, exercise is not a 10-mile walk. We obviously have to, get approval from our veterinarians that, that pets are okay to exercise. But really, if you start walking your, dog to the end of the driveway a couple times a day and then gradually increase from there, that's phenomenal. We don't have to, run a marathon to say we're exercising. As I said at the beginning, every little bit counts. I've had a couple of elderly owners that have a pug that is overweight, and they, we were able to just teach that pug some squats because they couldn't take the pug for a walk because of their own disabilities. So even just those squats, we were able to get weight off of the pets. So I want to thank you all and remind you to stay 6 feet apart and to wear your masks. And please stay well. Thank you so much for having me here today.